The Christopher Rose Community Empowerment Campaign serves the East New York and East Flatbush populations.
We are committed to building communities through strengthening families.
This video is part of a collection elevating the health narratives of the organization participants.
Hearing narratives from the perspective of the consumer is fundamental to strengthening the community from within.
In East Flatbush, 15% of adults report being uninsured, which is higher than New York City at 12% and Brooklyn at 12%. In East New York, 7% of adults report being uninsured, which is lower than New York City and Brooklyn. As defined in the New York City Sparks 2014 research, avoidable hospitalizations are those that could be prevented if adults had access to quality primary care. Both East New York and East Flatbush report higher rates of avoidable hospitalizations among adults than the rest of New York City and Brooklyn. In New York City, Black and Hispanic populations have higher rates of COVID-19 hospitalization and mortality than white populations. However, white populations have higher rates of in-hospital case fatality rates.
Reason why it is so complicated here with the healthcare rather than where I am from. For instance, I could give you an example where if I'm sick, I could go to the lab, do all the tests and be reimbursed back part of my money. Here you don't get it. And here it is difficult sometimes. Your insurance is not good, you can't have it, so you have to get out of your pocket. I went to the doctor and I was not well. And my insurance wasn't good, but I'm still on my husband's insurance, but unfortunately, they say I still couldn't get the treatment. And I think for that senior paying out of pocket at work, you should have insurance.
Do you have any healthcare stories or health experiences that you're comfortable sharing?
I could recall being at home and my dad took sick and he said that he couldn't walk. And he couldn't move his legs. And I called him. I could recall being at home and my dad took sick and he said that he couldn't walk. And he couldn't move his legs. And I called him and I said, Dad, I'm coming over. When I got over there, I took him to the hospital and it took like 4 hours before they attended him. And my father died the Monday morning. Yes, because he had blockage of circulation.
I'm so sorry to hear.
And I think that when you go to the emergency, you take patient, instead of they asking you for the insurance card, look at the person first and then the insurance card after, because lives matter more than the card.
Health stories that I've seen in working in the community itself, and like I was saying, working with clients that are immigrants, undocumented immigrants, non-English speaking immigrants, patient clients, I've heard a lot of horror stories, a lot of sad situations. People that have lost babies and we don't know how, they haven't been given proper interpretation. Because they don't understand the language, it's like they're being taken advantage of. And I feel as though they're being tested on. A lot of these women, they tell me they go in for prenatal care, and some of them have already had a natural childbirth. But it seems like everyone that goes in there, they always have to have a C-section. And they always right away, there's always something wrong. I had a young lady one time tell me she was very concerned. She was like, I don't see why I have to have a C-section. Why are they scheduling me for a C-section? I have 2 other children, which I had naturally. and they're saying that there's something wrong, wrong with the baby, and I have to have a C-section. How do they know that at this moment? She was very worried. Every woman that I know that has gone into that particular hospital, they're telling them that they need a C-section. It is pretty sad. I learned of a worker at the hospital that was supposed to be an advocate for these women, a support system, I would say. But later on, I found out that they were part of this conglomerate scheme to take advantage of the women, telling them that the ones that were undocumented, they couldn't get their visa renewed if they didn't pay their bills, that is their medical bills. And so they had to go to this office where they would make arrangements for them to pay their medical bills. And the office was nowhere connected to the hospital, but they claimed that they were from the hospital because they knew that it was just fear they were feeding these women. It was fear. And a very sad situation. They were being taken advantage of, and a lot of these women were paying unknowingly, that they're paying these schemers. And here was an advocate. That's what makes me so angry. Someone that they trusted, someone that gained their trust and was supposed to be there for them, supposed to defend them and work there. And they thought that this person was all for them. But in fact, they were taking advantage of them. Lord knows how much money they had collected already by taking advantage of these women. And then they didn't even know that they were on emergency Medicaid. They didn't have to pay it for anything. But then here they're telling them that they needed to pay so their visas can be renewed, or else they'll be in trouble.
I mentioned when I was having my second child, my second son, oftentimes I'd go into premature labor, so I would have to, I would get the contractions, I would have to go into the emergency room, let them know what was happening. But the way they would treat me when I would go in, I looked very young for my age, and they would think I was like a teenager, I guess, coming in. Here's this, young teenage black girl coming into the hospital, pregnant, and having some complications. They were very rough with me. And I would get really upset, and it was not until they would look at my chart and realize, oh, she's 29. Okay, she's not that young, So they would make these comments like, get undressed from the bottom down. And I would, question it because I'm like, I was just undressed, and I have to do it again. And so one time I asked the lady, I said, I have to do this again? Oh, don't act like you don't know how to do this. That's how you got here in the first place, isn't it? Whoa, okay. You didn't have to say all of that. That wasn't necessary. I'm here because I'm having some complications. Let's stick to the issue right now. So that was extremely frustrating for me. I would find that they would be particularly rough, especially almost like rushing me along in the situation. And it's not until I would speak up and start asking questions and engaging in conversation, and then they understand and realize, okay, this girl knows what she's talking about, and then their demeanor will change. One time I had to actually request that they give me a different doctor. I was like, I don't want to talk to her anymore. Can you please send somebody else in here to talk to me? I don't like how she's handling me. And so the experience was really, every time I had to go into ER, it made me think, oh my gosh, they're gonna think I'm young again, and they're gonna treat me rough, they're not gonna be nice. It wasn't nice. And no one should have to go through that. No one should have to, no matter how old you are, what race you are, what your situation is, what insurance you have, none of that should matter. You should be treated fairly and equally.
Yeah. So do you think it was your youthful looks, your age, or do you think it was race, or a combination of both?
I feel like it could have been a combination of both. I honestly feel that way because, I don't know, I kind of wonder if I was of another race but looked young and came in, will I still get that same treatment? Or is it because of my race and looking young, the two combined, just... Intersectional component. Yeah, exactly. Yeah. But no one should go through that.
I remember years ago, my family was still in Haiti, but my dad was here. and he got into a car accident. He was unconscious, but by the time he got to the hospital, he was conscious. And they then get him a head CT, and years later, he got that condition called epilepsy, and which could have been avoided if they at least had give them that head CT for them to see what was going on and stuff. So, yeah.